Pathogenicity of Polio Virus. Introduction. Polio virus is an enterovirus belonging to the Picornaviridae family. It causes poliomyelitis, an acute viral infection disease primarily affecting the nervous system. Transmission: fecal route, contaminated food, water. Etiology: RNA virus, small non-envelope, 3 serotype, type 1, type 2, type 3. Type 1 most common and most paralitogenic. Modes of transformation: fecal-oral primary, person to person contact, contaminated milk, food, water, rare respiratory droplets. Pathogenesis, pathogenicity, entry, multiplication. Virus enter body via or through pharynx or intestine. Primary multiplication in tonsils, pharyngeal lymphoid tissue, Peyer's patches. Virus spread to regional lymph node, bloodstream, primary viremia. Secondary viremia. Virus disseminates to reticuloendothelial system, liver, spleen, bone marrow. Further multiplication, secondary viremia. Invasion of CNS. Virus cross blood-stream barrier or via spread, retrograde and external transport peripheral nervous. Predilection or anterior horn cell, spinal cord, motor nuclei, brainstem and motor cortex. Neuron damage, selective destruction of motor neuron, degeneration, necrosis, result in muscle paralysis, flaccid type. Chemical stage of infection, impairment, infection 95%, asymptomatic, only antibody formation. Abrasive poliomyelitis, minor illness, fever, sore throat, headache, malaise, vomiting. Non-paralytic poliomyelitis, aspectic meningitis, stiff neck, back pain, muscle spasm. Paralytic poliomyelitis, facet paralytic, asymmetric, more in low limb. Bulbar poliomyelitis may affect respiratory center, life threatening. Pathological changes: congestion, edema, perivascular coughing in spinal cord, loss of motor neuron in anterior or inflammation, cellular inflammation, muscle degeneration, atrophy. Immunity: long life, type specific, both humor, IgA and cell mediated immunity play role. Factor affecting pathogenicity: virus strain, serotype, virulence. Host immunity, maternal antibody. Vaccine status: age, nutrition of host. Mode of infection, viral dose. Complication: permanent paralysis, respiratory failure, bulbar involvement. Post polio syndrome, year later, progressive weakness, fatigue. Prevention summary: immunization, OPV, oral polio vaccine, Sablin, IPV, intra inactive polio vaccines, talc, sanitation, safe water, hygiene.